Hello, welcome back. The question today is what happens to the mesh what we keep during the hernia surgery. This is the most common question when the patient comes to us for the hernia surgery. When we say your hernia we have to keep a mesh to repair it. This is the first question they'll always ask is what happens to the mesh after the surgery, whether it will dissolve or whether it will be there, whether it's very heavy, what will happen if I don't take care of the mesh. All these are the questions they'll ask. So what happens to the hernia mesh? Usually the hernia mesh is kept to repair or reinforce the weakest point in the body. That's a hernia. So we are reinforcing that tissue with a device, a medical device kind of thing. It's an implant kind of thing. It will be a permanent one. It will be there with your body forever. It will it will reinforce that particular area and it will mix with the tissues there and it will remain there in the body forever. And even the biggest mesh, the weight of the mesh is usually less than 10 grams to 20 grams. So you don't have to worry about the heaviness of the mesh. And mostly the mesh are all broadly into two types: absorbable and non-absorbable. Absorbable mesh, of course, they will be there in the body for some time, then get absorbed with the body. But nowadays these absorbable meshes are not that used, only very rare cases. And the non-absorbable meshes are usually synthetic or animal tissue made. These synthetic meshes are usually proline with other PTF, other combination of structures. If the mesh is kept superficially or in the inguinal region where the intestine will not come and attach, usually it will be a very synthetic proline mesh. If suppose the same mesh has to be kept somewhere in the abdomen where the intestines or colon or your urinary bladder or something has to come and touch, then it will be a little special mesh which is usually non-absorbable, but it will have a coating so that the other structures will not come and attach to it. And what are the complications that can happen with mesh? Usual complications we always is infection. It's a foreign body, so when we keep anything inside, usually the chance of infection is there, especially if they are diabetic or we do it as an emergency, there is chance of infection. So infection, the mesh can slip away, it can move away so that the hernia can recur. Another thing is the mesh which is synthetic, if it touches the intestine, colon or any other structure, they can irritate and cause adhesions, like the structures can get adherent and cause a lot of trouble, pain. And otherwise if the irritation is too high, it can even cause perforation, holes in the intestine or the structure, and even the holes can get into infection or they can cause fistula between two structures. So these are the complications, but these complications are very negligible with the advanced meshes available now, and also the technique involved. And so hernia mesh usually is a synthetic non-absorbable mesh which remains in the body, which incorporates itself into the surrounding tissues and remains there forever. It's not it's very lightweight, it causes less irritation, and it is safe. Thank you.